Hi, I'm Paul Kilgore at Wayne State University, and I'm here to talk to you about patient perspectives on shingles and post-herpetic neuralgia. We're very fortunate today to have Mr. Paul Fabrice with us and Dr. Lynette Moser. Welcome.
Glad to be here.
Thanks for having us.
So we really appreciate your being here because we really want to know more about what shingles is and in particular about what post-herpetic neuralgia is. And I'm going to abbreviate post-herpetic neuralgia as PHN. Is that okay?
Yes.
Okay, great. So Paul, can you tell us when you began to experience the rash and the pain of post-herpetic neuralgia?
I experienced pain on a Thursday, second week of July, and by that Saturday night, I had a rash appearing.
Okay.
And that lasted about 3 weeks, and then the post-herpetic neuralgia pain started after that.
Okay. And I understand you went to a doctor quite soon after the rash began because you were quite concerned about it.
Yes, I actually woke up in pain. It was about 4 in the morning, and I was at the clinic by 8 in the morning getting the medication at the pharmacy right then and there.
Okay, and that was the antiviral medication we call valacyclovir, is that right?
Yes.
Okay. And you took that for how long?
It was approximately, I think, 7 days.
Okay.
A couple of times a day.
Okay. But at that same time, I understand you had the post-herpetic neuralgia. And what did you do then for this pain? And can you describe the pain a little bit for us?
The post-herpetic neuralgia, as I understood it, came after the 3-week period, and the pain was quite intense.
Okay. Can you describe the pain for us a little bit more in terms of a shooting quality or stabbing quality or throbbing, and what exactly did it feel like?
Sure. There was the 3 pains that I think you mentioned. There was the internal stabbing, which was infrequent. There was a constant throbbing pain, constant from the minute you wake up, to the minute you go to bed. And then there's a surface pain, hypersensitive on the skin if you rub a shirt or if you run water over it or if there's a wind.
Okay. I imagine this must have really affected your quality of life and even things like sleeping. Can you describe how you dealt with that?
As best as I could. Sleeping was difficult. Sleeping pills, sleeping on my back only with an elevated head and an arm rested on a pillow. It was about the only position I could do, probably only about a couple of hours at a time.
Okay.
Yeah.
And so the pain began in mid-late July, the rash also, and then you experienced some discomfort that continued actually and persisted even to this day, right?
Correct.
Okay. And you've been through a series of medications, I understand, as well, including
Lyrica,
okay,
nortriptyline, Temodrol, lidocaine. Am I missing any?
The nerve blocks.
Nerve blocks.
Okay, the nerve blocks. Tell me about the nerve blocks and when you got those.
I got those in the second week of September, which should have been a couple months after.
Okay.
In the T3, T4, T5, T6 area. And I had that done 3 times.
Okay. And I understand even though you've tried some of these medications, they all by themselves, individually, were not necessarily very effective.
Correct. Nothing seems to really work.
Okay. So now we're here in early December, and tell me now about your pain management and what you're doing in terms of other interventions like physical therapy.
Sure. I've tried the ultrasound, acupuncture. We mentioned the nerve block, physical therapy and massage therapy, and I try and exercise as well.
Okay. And Dr. Moser, Lynette, I know this has been probably very challenging as a spouse of Paul to kind of watch and have his experience there. Can you describe to us what your observations have been and what you have seen Paul go through?
So I've really watched him try to figure out how to deal with the pain and understand the pain and how long it's going to last, if there's a way to understand that. He initially went back to work. He's a high school teacher. He went back to work the first week of September and then realized that that just wasn't working for him. So when he was early on his leave, people would say, you know, how are you? How are things doing? How are you feeling? And he would say, I have this pain. It could go away tomorrow, or it could last. You know, nobody really knows. But I saw kind of him learn to deal with the fact that really there wasn't going to be a magical point where the pain was just going to go away. And then he had more and more physicians say to him, you know, for some people this pain never goes away. So I saw him go through kind of the mental adjustment to say, wow, how am I going to learn to deal with this? And then, you know, kind of, you know, getting through that and seeing now the pain seems to be a little bit better. He's sleeping better through the night. He's staying in one place at night. He was sleeping all over the house for a while. And so I feel like he's gone through an adjustment with that, and also learning how to adjust his medications to deal with the pain, and realizing that he's the only one that understands his pain and knows what he's feeling, and that he's the one who decides how he's going to treat it and what he's going to do for himself.
Right. Well, in summary, it sounds like you've really been through quite an ordeal, I have to say. From July to this time, December, you have really worked hard to manage this, and I give you fantastic congratulations in everything you've done. I wondered, Paul, in your thinking back now and reflecting just for a couple seconds, what would you tell our audience in retrospect to do in case they have a pain like this, or shingles or post-herpetic neuralgia?
I understand the medication. Time is of essence to see a doctor, get the medication right away. I don't know if you can get a vaccine at that point, if it would be too late. Other than that, I don't know what else you can really do.
Okay. Well, that's very important information. You're right, there is a vaccine available. It's typically given to prevent shingles and post-herpetic neuralgia complications. It is an effective vaccine. It's typically recommended for adults 60 years and older. There's a newer vaccine we expect in the next few months, and in future segments we'll look forward to talking about that as well. For now, we wanted to thank you very much for being here. We're so glad you had time to join us today, and come back again soon. We look forward to talking with you again about your experience. Thank you.
Thank you.
Thank you.
I'm Paul Kilgore for Patient Perspectives, and we thank you very much for watching today. Well, we've been talking here today about shingles and post-herpetic neuralgia, or PHN. One thing that's very important to know about shingles and PHN is that it can affect even previously healthy adults. And although it's been found and observed in older adults, we can find it in younger adults and even children at times. Post-herpetic neuralgia is a sequelae, or a long-term complication that can occur following the onset of shingles. And even though the shingles rash may resolve, we know that post-herpetic neuralgia can continue and persist for weeks, months, and even years after onset of the shingles rash. We also know that there are treatments available to control shingles and the pain associated with post-herpetic neuralgia, but the treatments are not 100% effective. In fact, many research studies are going on now to try to identify new ways to control the pain associated with post-herpetic neuralgia. In the meantime, we rely on a multitude of interventions, including physical therapy, drug therapy, including pain relievers. We also rely on other non-traditional forms of therapy, including acupuncture. Sometimes exercise therapy has been used. Ultrasound has been used as well to control the pain. And for prevention, we really stress the need for shingles vaccines. Shingles vaccination is recommended now in the United States for adults 60 years and older, and a newer vaccine is now under consideration by the U.S. ACIP, or Advisory Committee on Immunization Practices, and we do expect some more information about this vaccine to come available in the next few months. I'm Paul Kilgore, and I'm so glad you had a chance to join us today. Thank you very much.